You guys are doing well. Today, we will talk about massage. All right, massage is a manual therapy technique. It's a modality that produces physiologic effects through different types of stroking, rubbing, and pressure. The therapeutic effects of massage include altered pain transmission, decreased anxiety and tension, decreased muscle atrophy, decreased muscle spasms, facilitating healing, improving circulation, increasing lymphatic circulation, loosening adhesions, reducing swelling or edema, relaxation, removal of metabolic waste, and to stimulate reflexive effects, primarily relaxation and could include relaxation of the muscles or stimulation of the muscles, depending on the desired effect and the type of technique being used. Some of the indications if someone has adhesions, bursitis, decreased range of motion, edema, intermittent claudication, lactic acid excess, which will cause muscle soreness after working out, migraine or headaches, muscle spasms or cramping, pain, Raynaud's phenomenon, scar tissue, tendonitis, and trigger points. Those could all be indications that a massage would be a good option for treatment. Contraindications include acute injury, arteriosclerosis, cancer, cellulitis, embolus, infection, and thrombus. The direction, typically we massage towards the heart or from distal to proximal. However, you can, for various reasons, massage in different directions depending on the goal. Maybe if you're loosening an adhesion and that's the direction that you need to go to break it up, then you can. Some of the terms used for the direction of the massage are centrifugal, which is away from the center. That's less common, but can be used, and centripetal, which is towards the center, which is the most common, always towards the heart, whichever area you're coming from, towards the heart to push the edema and the waste materials back towards the heart. Some of the parameters. The duration just completely depends on the body part, on the goal, on the patient's tolerance, but typically we do between 8 and 15 minutes, just depending on the patient. The frequency, that's the rate at which a technique repeats itself. So typically you'll repeat one massage technique several times before switching to the other. If you're constantly doing different techniques, it's probably going to cause them to tense up and not be able to relax as much. So remember that as you're going through your massage. The pressure, this is the relative amount of compressive stress that is applied to a body or a body part. And it's typically described as either light, moderate, deep, or variable. Typically, we start out with light and we gradually increase the pressure as the patient tolerates. Of course, always let the patient know to keep you informed on how they're feeling and let you know if you need to back off. And then eventually, as we're ending the massage, we'll go right back to our light strokes before we completely end the massage. Rhythm is the relative regularity of the massage. So if, I know I have a thing I wanted to say. If it's applied with consistent intervals, then it's considered rhythmic. If it's inconsistent, then it's considered non-rhythmic. So you want to be more rhythmic, more consistent with the speed and the types of stroke, even the length of the stroke, to help the patient relax more. The speed is just the rate at which the therapist's hands moves, and we describe it as either slow, moderate, fast, or variable, but typically more slow and rhythmic helps with relaxation. More fast speeds could help with muscle activation if that's your goal. So it would depend on your goal, but for the most part, most of our massage techniques are performed in either a slow or maybe even slow to moderate speed. Massage techniques include effleurage, friction, petrissage, tapotement, and vibration, and we will go through each of those. So effleurage is light strokes to produce a reflexive response. It typically is at the start and the end of massage to help a patient relax. the strokes are directed towards the heart, and you can increase the depth of the strokes, and the more deep effleurage can also produce mechanical and reflexive responses. Friction gives small circular motions over a trigger point or a muscle spasm. Deep pressure with a friction massage, the deep pressure helps to reduce edema, loosen adhesions, relieve muscle spasms. It's often used with chronic inflammation or with overuse injuries. And you can go in various directions. There's also the cross friction massage, which typically finds the adhesion and goes kind of perpendicular to the direction of the adhesion to break up some of those adhesions. This is the only one we typically don't use massage cream with cross friction or just friction massage or with myofascial release. So some of the releases we went over in class, like the psoas release, the piriformis release, as you notice, we didn't use any massage cream because you want to kind of trap the skin under your hand. You don't want to slide off of it, especially when doing a friction massage. Petrissage, the muscle is squeezed and rolled under the therapist's hand. It's also called kneading. The goal is to loosen up adhesions, to improve lymphatic return, to facilitate removal of metabolic waste from a treatment area. It's typically, again, performed distal to proximal, and it can be performed with as little as 2 fingers for a smaller muscle group or both hands for a larger muscle group. A lot of times I use this on the upper trap. The petrissage on the upper trap usually feels really good. You kind of trap the muscle underneath and you kind of gently roll off of it to help loosen up those adhesions. Tapotement, this provides stimulation through rapid alternating movement such as tapping, hacking, cupping, or slapping. It is used to enhance circulation, to stimulate peripheral nerve endings, to basically increase the muscle activation. So I will do it while a patient is doing exercises. So if I'm saying lift your arm and I want the anterior deltoid to work better, it's just the only one you can see in the picture, then I might tap it while I'm having them flex so that I increase the activation. One muscle group I use it on the most is probably gluteus medius, where I get over the gluteus medius and I do quick taps while they are doing like single leg stance or lunges or squats or some type of balancing thing, to try and kick that gluteus medius in and increase the activation of that muscle group. Vibration, you typically use the therapist's hands firmly on the treatment area and use rapid shaking motions to vibrate the tissue. The motion is initiated by the therapist, either their forearm or their palm, a larger surface area. So it's similar to those oscillations that we've learned before that help with pain gating and help with relaxation, where you're only moving pretty much either the skin or maybe just a little bit deeper levels of muscle tissue, and you need to remain with or continue with firm contact on the patient's skin throughout the whole process when using vibration, and it's primarily for relaxation. It's primarily to help the patient relax so they can tolerate what other treatments you're doing in addition to that. Some of the procedure, you want to explain the procedure to the patient. You want to give them the risk and benefits, give them an opportunity to consent, inform them what to expect, tell them that they need to relax and to communicate with you throughout the session so that you know if you need to back off or if the pressure is a good amount. And then you want to position them in a way that's comfortable for the patient, but also that the body part that you need to access is exposed, while all the other body parts you don't need to access are draped and covered for modesty. So although these have 1, 2, 3, 4 on them, you could switch 3 and 4. This isn't the exact order they have to be in, but you do want to get consent at some point before starting the procedure. Some of the tips, you want to keep contact with the patient's skin at all times. You don't want to just touch the skin and keep moving your hand off between each stroke, because every time you take your hand off, once you touch them again, they will tense up a little bit. So it's really hard to relax if somebody is not in constant contact with the skin. Slow rhythmic motions are best in most cases, unless you're trying to use tapotement or vibration, that where you need a faster speed. Larger surface areas disperse forces to make them more comfortable for patients. So sometimes if you need to do a deeper massage, you may decrease the surface area and use more like your thumb, or I typically use like the palm of my hand, like that. But if you want to use a larger surface area, I either use my whole hand or sometimes my forearm. I personally don't ever use my elbow because it's super uncomfortable for a patient. So I wouldn't really recommend that. Um, Warming the massage lotion and or your hands and providing warm towels or sheets or something to keep the patient warm can help them relax. Ideally, the room temperature needs to be between 72 and 75 degrees. So if you can't really change the room temperature, then I would put more layers over them, or maybe even use a hot pack, maybe to their lower back while you're massaging the upper back or something, just to keep them warm so they can relax. Dimming the lights, working in an environment with minimal distraction is also helpful. So if you're in a really busy treatment and you're not in a private treatment area, don't expect them to be able to relax very much. And then you want to always gradually increase and decrease your pressure. So at the beginning, you start out light, you gradually increase the pressure, always asking the patient for feedback and if it's too much. And then at the end, before you take your hands off the patient, you want to do a few light strokes again with less pressure to prepare them to end the massage. You don't want to go just really firm, deep pressure and then just be done, because they'll probably tighten back up. Massage cream is not used with friction massage or myofascial release, like I mentioned earlier. And that's really all we're talking about for massage today. So, we will we have already talked about like certain releases, some of the myofascial releases, psoas and piriformis and different things. We'll practice a lot of these techniques in class. And if you have any questions, just let me know. I'll see you in the next lecture.